Greetings, everyone. Today I want to talk about one of the things that I think is probably one of the most important things that we can do in our therapy sessions, in our coaching sessions. If you're coaching, you definitely, hopefully, are doing this as well, and that's setting goals. Now, we all have been trained to set treatment goals, outcome goals, and those kind of things. But what I'm finding with a lot of therapists I talk to, a couple of issues. One is they're not setting goals that are specific enough, or they're forgetting the goals that they set and tend to wind down a path that doesn't quite serve them or their client. So, real quickly, setting goals, very important. And the most important thing is that we are setting the goals with the client. We are co creating a future outcome with the client. The client's goals are what we need to be working toward. We're there to facilitate, to tweak, to give ideas on how to reach those, and also to get our clients to think specifically about how they'll know when they have the goals. Now, when we have people who experience depression, anxiety, those kind of stressors that they go through, it's real easy for them to be so entrenched in that specific way of being in the world that sometimes their ability to set goals become very vague. So you may get someone who's depressed and says, well, I just want to feel better, or I just don't want to be depressed anymore. So it's important that we get realistic and say, okay, well, if you can't automatically go from not depressed, from depressed to not depressed, can we set short-term goals? So if you're depressed every day in a week, maybe half that week, decreasing the time that the person experiences depression. We also want to know specifically what's not depression. So how will you know when you're not depressed? What specific things will we see you doing? It's real easy to get caught into that whole affective paradigm to where the client will say, well, I'll know it when I feel it, but we need to have them to know it when they see it. Sometimes people get so used to being in a certain emotional state that when there are small changes, so they're making small bits of progress, they sometimes don't even acknowledge that because they don't notice it. So having clear goals, short-term and long-term goals, that can be spelled out in action steps, performance, what's happening now that you're not depressed. What are you doing that you no longer have depression that you weren't doing before? How often are you doing that? Now, you have a couple who's arguing. They say we argue every day. Well, maybe a short-term realistic is that you argue only, out of the week, 3 days or 4 days out of the week. And then when you know the problem's been eradicated, maybe it's you argue only one day a week. And then you also want to know what arguing looks like. How will I know when there won't be arguing? How will you be communicating when there's no longer this thing that we've named arguing? Because everyone has a different definition. When you're working with people, if you have a clear guide of what the outcomes or desired outcomes for the client are, it's a little easier for you to stop getting lost in content and going down rabbit holes. It's real easy the client wants to talk about something, and we don't want to honor where they want to go. But sometimes it goes in directions that we don't think is really helpful for us getting our goals. So a way to gently kind of bring them back to a focus on the outcome that both therapist and client have mutually agreed that's what the client wants or needs to have. So if someone's outcome is that they want to not be anxious as much as they are, it's really important to keep that present and future focused view of the goal. Yes, it may be helpful for the client to unload some emotional baggage about how they grew up in an anxious household or those kind of things, and that's important to acknowledge and honor their story. But the more we stick to those goals to say, okay, we're doing this, but we still have a goal, a weekly goal, maybe session by session, to a longer term goal. I find that coaches tend to be a little better at this sometimes than therapists about getting really specific goals and doing the measurable and realistic timelines for those goals. So if you have a client who has obsessive compulsive disorder and they are wanting to eradicate their problem, having the goal of the extinction of the problem is pretty good, but maybe a long-term goal. Maybe just in the next couple of weeks, getting them comfortable with acknowledging what's really happening, good, educational, psychoeducational matters in place, but to really begin this process that we stay focused on the outcome of the eradication or the decrease, depending on what your client wants. A lot of times clients just don't know what they want. They think they do, but it's really just the absence of what they have. So we need to be clear on, if I don't want to be depressed, I don't want to be anxious. Okay, well, what do you want instead? It sounds like you've been in this depressive state and you're aware of that, but what would you like to feel instead? What would you like to do instead? Because it gets their brain focused on the long term, the road that's ahead of them. If we spend way too much time, again, on psychological archaeology and get away from those goals, well, therapy starts to slow down. It starts to become kind of stuck in things that can't be changed. Goal setting and following through of action that help us get to that end game and the goal is where change happens. So when you're setting your goals, most of us set goals, good therapy goals. How specific can we get? Can we do a weekly goal, a monthly goal, every 3 months, however it is? But they need to be specific action steps that we can check in every other session or however you do it. Okay, we said that you said part of not being depressed was you'd be going back to church again. Okay, how often would you be going to church? What days would you be going to church? When we're in 3 weeks, how many times will you have gone to church to know that things are happening? A big goal is, how will you know when you're really no longer need to come and see your therapist? What's happened? What's different? And from those kind of questions, you can get all kinds of things that you can flesh out into action steps that can assist the client, keeping them on task and really keeping ourselves on task, focusing on what we know is the most important thing in therapy, which is the outcome that the clients want for themselves. Anyway, have a great day. You have any comments, put them below. Feel free to subscribe, and I look forward to seeing you in the next one.